Welcome to Doc Talk, where we talk about topics our patients are asking about. Hi, I'm Tristy and I'm a board-certified pediatrician. So let's talk about how you can care for your child with a cough or nasal congestion. One thing you can do if they have a runny nose is to help suction out that mucus, because as you may know, when a baby has a runny or clogged nose, it's hard for them to feed on a bottle or a nurse. So if you have your bulb syringe, you would squeeze it, and then you would insert it into the baby's nostril, and you want to make sure that there's a good seal with the skin around the nostril and the tip of this bulb syringe. And then you just release it slowly, and that will suction out some of the mucus and help clear out the airway. If the mucus is a bit thicker, then you can use a couple drops of nasal saline. You would have the baby lay down on their back and just put 1 to 2 drops in each nostril, let it sit for a whole 60 seconds, and then again use your bulb syringe to help suction it out. In addition to your bulb syringe, there are electric nasal suction devices, and there are suction devices with a straw that you would use your mouth to create the suction. And these can also be used in babies. You do need to be careful because if the suction is too strong, it can irritate the inside of the nose, and that can cause swelling and make it a little bit more difficult for the baby. To keep babies hydrated when they have a cold and cough, you may need to feed them more frequently than usual because they may have lost their appetite. They might not take as much at each feeding time, so you may have to offer them smaller amounts more frequently. And breast milk has the advantage of giving the baby antibodies that can help fight infection and giving the baby immune modulators, which are things that stimulate the baby's own immune system to help fight their cold viruses. And formula-fed babies should still keep drinking milk if they will take it. If the babies are refusing milk, you could try Pedialyte to keep the babies hydrated. One thing you can do for older kids older kids being toddlers and preschool-age kids, is you could have them stand in a steamy shower, and you could put some toys at their feet and have them bend forward and play with these toys for a couple minutes. And sometimes the steam, which loosens the mucus, along with gravity, which helps the mucus come forward, will help them get that mucus out. And especially if they already know how to blow their nose, that can be particularly helpful. Cysteine in chicken soup is also helpful. So if you ever wondered if chicken soup really is helpful, it definitely is. Cysteine helps break down mucus and thin it out, so chicken soup is good for a cold. Another thing you can do for kids older than 1 is to prop them up in bed. When you're laying flat on your back, the mucus that's produced in your nose kind of pools in the back of your throat and can trigger more coughing. And with a little bit of gravity, that mucus can drain more easily. So giving the child 1 or 2 extra pillows to put them in a semi-reclined position can help with the coughing at night. For Doc Talk, I'm Dr. Tristy, and here's to your health.